Hi, good afternoon. My name is Bruno. I am here to talk about Ibogaine treatments in Brazil. First of all, I want to thank you for the invitation to do this presentation, and I'm sorry for not to be in there with you. So I am the first medical provider in Brazil. I work with Ibogaine here since 1994. I've done more than 1,000 treatments since then. The most experience we have here in Brazil with Ibogaine treatments is with stimulants dependence. We don't have a lot of opiates or heroin addiction here in Brazil, but we have a lot of cocaine and crack cocaine patients. We have published some papers on Ibogaine, the first of them treating drug dependency with the aid of Ibogaine, a retrospective study which was published in 2014. The other one was a qualitative study published recently in April this year, and that third one, a phenomenological study about Ibogaine effects to be yet published. I helped Gita people to write the clinical guidelines for Ibogaine-assisted detoxification. I am a former Gita's board member and director. Well, Brazil has the most rigorous laws about prescription medicines in the world. This happens because some years ago, a lot of women got pregnant after using birth control pills containing wheat flour. After that, the government decided to publish a very rigorous law forbidding you to sell, to buy, to use, or to prescribe, import and bring with you unregistered medicines and medicines from unknown origin. This situation can lead you to some years in jail with no bail. What is a registered medicine? A registered medicine is a medicine that is previously submitted to the Anvisa, which is our FDA, who will analyze it, the documentation, the scientific evidences, if it's registered in other countries, if its package fits the standards about labeling and sealing, etc. And after this registration, the medication is able to be sold in pharmacies. Only registered medicines can be prescribed and sold in Brazil. But there are a space for using non-registered medicines since you fit some regulations from the Anvisa. As Ibogaine is not forbidden, not controlled, and not banned here in Brazil, Anvisa allows people to buy it abroad and import it for personal use. For this, you need a medical prescription, and you need to buy it in your name for your own use. We have some laws that allow it. And this laws states that non-registered medicines can be imported and used since they have, as I said, the medical prescription, and since they are imported in the name of the patient for his or her personal use, and in the amount for a single or a short period usage. This law is being used to import a lot of unregistered medicines like cannabidiol CBD, for example, and medical marijuana preparations. This kind of importation, it works, but it's not perfect. It has some disadvantages, like it takes a lot of time, around 30 days to arrive in Brazil. The patient must wait for this time to use the medication. There are costs hiring brokers to help release the medicine from customs and at the airport. You should dismiss any amount that is not used. It can't be traded. You can't negotiate this medication. It is a crime for to negotiate this kind of medicine between people, and it needs a medical prescription to be important. So all these disadvantages makes the cost higher than other options, but it's the only way to do it legally nowadays. As I said before, in 2014 we published a paper on Ibogaine with the help of Dr. Eduardo Schemberg, Maria Angélica Gomes, and Professor Dartil Xavier. And this paper, it was a retrospective paper. We analyzed people that took Ibogaine and we followed them for around a year. And after that we reached around 62% of abstinence. This work had a lot of repercussion here in Brazil, and after that I was invited to talk with the people at the State Council on Drug Policy and in the National Secretary on Drugs Policy in the Ministry of Justice. And after this talk, where we explained it to the people there how Ibogaine works and what are the problems and the possible reactions, adverse reactions to Ibogaine treatments, mainly the cardiac effects. After these talkings and after these meetings, the State Council on Drugs Policy published some resolutions trying to regulate the Ibogaine use in Brazil. The most important resolution that they published was that they decided to make it obligatory to make Ibogaine treatments in a hospital setting with proper clinical follow-up, psychological and psychiatric follow-up, and following all the good recommendations to clinical practice. So these resolutions, they had more repercussion outside Brazil than inside Brazil. Inside Brazil, people, although illegally, people are still selling Ibogaine, still importing non-official and non-regulated medicines, and still using Ibogaine in a dangerous ways, in underground clinics and in places that has no conditions to deal properly with some reactions that we all know that Ibogaine can show. Recently we published a new paper on a qualitative paper on Ibogaine showing that even people that relapsed after Ibogaine, they show improvement on the quality of life, and they begin to deal better with the problems of life and deal better with their families and their work. So it shows that Ibogaine, it's not only important to give the people an opportunity to be clean, to be away from drugs, but an opportunity to improve their quality of life and to improve the happiness of their lives. The next steps that we are planning in Brazil is to extend the regulations from the São Paulo state to other states and to register the medicine. And after that, we wish to help the government to set up a policy which will allow the government medical staff to be trained and to prescribe and use Ibogaine in medical facilities in our country. Thank you very much.